I'd like to introduce Scott Smith, PA. He is the president of the Central Florida Functional Medicine. We're going to be speaking about microbiota and autism. Welcome, Scott.
Hi, Kristen. Great to be here today. Thanks for having me.
I very much look forward to talking to you about this. I think this is a subject that a lot of parents don't really understand. And so when we talk about the word microbiota, what does that term mean?
Well, the microbiota is actually a representative of a community of microorganisms, both commensal and pathogenic, which can reside within the human body, hopefully in a symbiotic way. The term can also be used to describe the collection of genes that belong to these microorganisms. It's thought that these genes are of great importance to humans, as our bodies alone have only just slightly more genes than a basic earthworm. When the microbiome is healthy and working symbiotically, we're able to utilize this genetic material to our benefit. I personally use the term interchangeably between these two meanings of both the organisms themselves and their genes.
And so when we're looking at how it relates to, if I'm going to say this right, dysbiosis and is it called Sibo? How does that relate to that? I've heard of both those words, and I know there's parents out there going, they've seen those words with that. Am I saying those words right, Scott?
Yeah, well, Sibo and dysbiosis. So yeah, these are very hot topics in autism right now. Dysbiosis and Sibo are actually becoming more widely discussed by the day. They're a little bit more in-depth way to describe adverse conditions of your microbiome. Dysbiosis is actually a descriptive term that refers to an imbalance or an overgrowth of pathogenic bacteria, although I personally use the term dysbiosis referring to yeast at times. In addition, I also talk about something called an insufficiency dysbiosis, which is consistent when you don't have the right amounts of normal flora in your GI tract. So pure dysbiosis is pathogenic, and then an insufficiency dysbiosis is a lack of the good guys. Then SIBO, or small intestinal bacterial overgrowth, would be a dysbiosis, but located specifically within the small intestine. This can be caused by an overgrowth of pathogenic bacteria or even by an abundance of healthy flora.
Okay, so when the parents are looking at that, at least we have a better understanding when we see those words and we're at a conference or a lecture, and we see those words. A lot of times this isn't what we've typically learned, when we were reading the pregnancy books, And so when you're looking at all that, what are the most frequently encountered pathogens in your practice?
Well, I'm sure that every family that has a child with autism that uses a biomedical approach has probably dealt with a yeast overgrowth at least a time or two in their life. So I'd say yeast and fungus are pretty common findings. Different subspecies of Clostridia. Another form of bacteria called an Enteric Coliform Bacteria. And then we actually do find occasional parasites in our kids.
And so you mentioned Clostridia. Is this what we think of as C. diff?
Well, it could be, Kristen, but it's usually not. There are actually several subspecies of Clostridia. Some of are pathogenic and some are not. But Clostridia byproducts from multiple species can disrupt dopamine metabolism and even lead to microglial activation and decreased glutathione stores in our kids. C. diff is really associated with new onset foul-smelling diarrhea occurring 3 or more times per day for more than 2 days. But in severe cases, the inflammation that's caused by this Clostridia difficile or C. diff can actually be so severe that you may actually see it with no diarrhea at all. In general, when I do have a case of C. diff, which is probably a couple times a month, it doesn't have the classic diarrhea presentation. It's got so much inflammation associated with it. Clostridia in small amounts is part of everyone's healthy, normal flora, so a small amount is okay. But the thing we worry about Clostridia when it becomes a dominant species is that this is a spore-forming bacteria. And the more spores that you have left behind, the higher your rate of recurrence. So treating a Clostridia overgrowth is great, but it does have a high reoccurrence rate.
Are there symptoms involved with, when they're looking for C. diff or Clostridia? I mean, is there constipation or diarrhea? Or if it doesn't sometimes always show up?
Doesn't always show up with a GI symptom. So C. diff, again, in the general population, when I worked in traditional medicine, would always be a diarrhea-associated disease. That is not the hallmark for what I see in our children with autism, though. I see more of the inability to poop or more of a constipation with our C. diff kids.
And you mentioned something called Coliform Bacteria. What is that?
Yeah, the Enteric Coliform Bacteria, this is a group of bacteria. They are what we call gram-negative, so when you do a type of a test called a gram stain, they would be negative on that test. And they have a really high capacity for fermentation. Some common bacteria that you guys have probably seen when you've done stool tests before, things like Citrobacter, Enterobacter, Hafnia, Klebsiella, even E. coli is a enteric coliform bacteria. These are bacteria, they do not form spores the way that Clostridia would, and they all contain in their cell wall something called lipopolysaccharide. And that's a really important thing to know, because lipopolysaccharide causes a lot of problems.
And so, when I'm a parent, right? I'm thinking, how do I know if my child has any of this? And is there tests that we can do to look for this? If it's, and if the test doesn't show, is the test always accurate? I guess that's the better question.
Well, the tests are getting a little bit better each generation of them that come out. So Clostridia in particular was always relatively difficult to isolate. It's an anaerobic bacteria, so it dies in the presence of oxygen. So growing it in a traditional culture was often very difficult. C. diff can be checked in a stool culture because you're not actually measuring the bacteria. You're trying to measure for the C. diff toxin, which is not the same toxin that's created by other forms of Clostridia. So the newer technology allows you to identify these other non-C. diff species of Clostridia. The enteric coliform bacteria are relatively easy to identify and can show up in a traditional stool culture format.
And so these are just kits that a family gets from their doctor or whoever is working with them, and basically, I guess they just take a stool sample and then they send that in. Is that correct?
Yeah, so through your traditional labs like your LabCorps and your Quest Diagnostics, you could get a C. diff toxin. You wouldn't be able to get something from a lab like that on the additional species of Clostridia. And their regular stool cultures don't look for the enteric coliform bacteria, so we do use specialized labs for that type of thing. There's a number of them out there. I don't want to slight any one of them. We've used all of them at various times, but there are a number of labs that do offer stool testing that would give us a fair amount of knowledge and some guidance on how to treat abnormalities of your microbiome.
And so when you're identifying abnormalities in microbiota, why is that important in autism?
Well, when we have new patient consults, GI symptoms are often one of the most prominent things discussed at our first meeting. When we go back and we look at the literature is strongly suggestive for GI abnormalities. And oftentimes prior to the initiation of classic ASD symptoms, these kids are already starting to have GI tract issues, whether it be excessive spitting up or vomiting, abnormal eating patterns, bloated belly, or classic colic. These are things that we hear commonly. It's also believed that the immune system plays a large role in the symptoms of autism. And 70% of that immune system sits in the GI tract. So if your GI tract is broken, you'd expect the rest of the immune system to kind of follow suit. And dysfunction and imbalance of the microbiome is a relative common finding. We hear it in all of our patients at our clinic. And when I talk to other providers with similar types of clinics, they hear the same things. Many of our kids also, because of their inability to express or describe their GI discomfort or symptoms, and add to that their distorted pain thresholds, we really got to be proactive with this type of evaluation. So I usually get some basic testing on all patients at their first consult, and then depending on whether or not your history or physical exam dictates or the first round of testing dictates it, then there are additional, more comprehensive tests.
Is there a lot of research supporting all this type of stuff that you're talking about in autism?
Absolutely, Kristen. As you know, there are a ton of studies out there. There's too many of them to go over on any one day like this, but a few of them that I refer to on a very regular basis. Dr. Sidney Feingold and his group at UCLA found that oral vancomycin led to significant symptom improvement in children with regressive autism. And in that study, they also identified 9 species of Clostridia that they didn't find at all, not a single cell in their healthy control groups. In addition, the children with autism also had an abundance of that non-spore-forming anaerobic bacteria in the gastric and duodenal sample. So it was in their stomach and the first portion of their small intestine. For healthy people, that's usually a really privileged area. The bacteria doesn't tend to grow there because it's relatively acidic. Yet in our kids with autism, there was a large amount of bacteria in those areas, and none of the control group children had large populations of bacteria in this area. An additional study a few years later was by Parecho and his group, and they found higher levels of a specific type of Clostridia called Clostridia histolyticum in children with autism versus their control groups. And this Clostridia histolyticum had some neurologic consequences. And then the year following that, in 2006, Dr. Derek McFabe and his colleagues found that injecting propionic acid into the brains of neurotypical mice, and propionic acid is the toxic byproduct from Clostridia metabolism, that it induced autism-like features in mice who are otherwise neurotypical. And their symptoms that they developed from this were really interesting. Hyperactivity, they started to spin, they had repetitive behaviors, and even some of them had some unusual seizures. So this is things that we see in our ASD kids all the time. More recently, in 2010, Dr. Emanuele and his group in Italy reported finding low-grade endotoxemia in patients with severe autism. Endotoxin is another term for lipopolysaccharide, which I mentioned earlier. And the lipopolysaccharide, of course, is the byproduct from that enteric coliform bacteria. It is a protein that's in the cell wall of gram-negative bacteria. And most recently, an article written by Dr. Richard Fry and Dr. McFabe showed that the toxins from Clostridia species actually poisoned the mitochondria and changed around how the Krebs cycle worked. So there's a lot of research. That's just a few samples, but there's a lot of research that really demonstrates that this has a lot of role to play in helping our kids with ASD with their short-term symptoms and their long-term treatment plans.
Definitely seems that these studies are giving us some clues and some insight into what our kids are dealing with, especially, if the mice are doing, autistic type behaviors. I mean, it seems as though that's a great lead in order to maybe find some better answers out. Would you agree?
Absolutely. And, these studies are not happening by chance. So these studies are being done because parents are reporting that their kids are having GI symptoms. And so we're doing, I say we are loosely. So these organizations are doing research because the parents are basically dictating that, hey, this is a big problem, figure out what's going on. And so it comes full circle. So the parents give a history of GI complaints. It reaches the ears of people in the know that can do research and studies. They identify things that are potentially problematic, come up with solutions, and then it feeds back down the train to guys like me so we can initiate treatment.
And years ago, the definition of autism, I don't remember ever seeing it talk about GI symptoms. I mean, am I wrong?
Yeah, it's actually not in the diagnostic criteria for autism at all.
And yet how many kids on an average, I don't know what the statistic is, but it seems as though, just from the parents I know, and I'm sure all the parents you treat, it seems like it's like the foundation of many of our kids' issues. It seems to lie within the digestive issues and the digestive tract and the gut.
I agree wholeheartedly. Even when you go away from microbiome abnormalities, other GI symptoms, whether it be constipation, diarrhea, food allergies, reflux, these are things that really affect our kids on a day-to-day basis. So having a better understanding and a better way to treat and manage these are only going to be of benefit to our families and our kids that we're taking care of.
Now, what types of symptoms can you see when there's an imbalance in the microbiota?
Well, it could be quite diverse, but some of the more common signs and symptoms that we would see would include those children with the big distended abdomens. Sometimes they're distended all the time. Other times they start the day off flat, and as they eat and put food in their belly through the day, the belly gets distended throughout the day. We see constipation, we see diarrhea, we see constipation alternating with diarrhea. We have food intolerance, we have sleep dysregulation, especially those kids who like to get up in the middle of the night and not go back to bed. We often associate that with an abnormality of that microbiota. We can get aggression and agitation. We see increased sensory issues. We can get headaches. We can get joint pain. The list goes on and on, really.
Now, you kind of touched on this, but just for a little bit more clarity, can there be imbalanced microbiota without obvious GI symptoms?
Absolutely, absolutely. So it's easy to make the call to evaluate a GI tract in a kid who has obvious GI symptoms, but the real challenge is getting a good evaluation on a kid that presents with no GI symptoms. It's often difficult to proposition a family to use their valuable resources to test something that from the outside looking in does not necessarily appear to be broken. It's not impossible for there to be no overt GI complaints and for there to be microbiota imbalance that is causing seemingly unrelated symptoms. An actual report that was published in the Journal of Autism and Developmental Disorders in 2012 that found that unusual sleep and unusual eating patterns as well as oppositional behaviors were strongly associated with these types of GI problems. Those would not necessarily be considered traditional GI symptoms.
Well, it's fascinating because, I talk to so many parents throughout the year, and especially a lot of the new parents that are listening, I'm sure some of them might think, well, my child doesn't have any GI issues. I've heard this many times of, no, they have regular bowel movements, they seem okay, but yet they're having other symptoms of, characteristics of autism and other things aren't working. I mean, it seems to me it'd be, to their advantage to look into something like this when, even though there are no GI symptoms. Would you agree?
Yes. The human body is remarkable and amazing. It never ceases to amaze me at what it can do. The human body is designed to find a point of balance. Now, some of these kids find a point of balance where they don't have a classic GI symptom, where they're pooping every day and their poop looks relatively normal. But when we start to pull back the layers like on an onion, we find that their balancing point is very different than where we think they should be. And it often leads to a set of cascading events further downstream. So your symptoms are not necessarily occurring in the gut, they're occurring elsewhere.
Now, what might cause someone to have abnormalities in the microbiota to even begin with?
Well, the list is pretty long, so let's just start from birth. So you are going to be predisposed to having a low biodiversity of your microbiome if you are a C-section baby. The initial bacteria that colonizes your GI tract is often received from the birth canal. So C-section babies don't have that opportunity. Also, with C-section babies, those moms are often given an antibiotic as an IV during the procedure, which also gets them started off on the wrong foot. You can get some bifidobacter species from breast milk as well. So babies who have not been breastfed will tend to have a lower biodiversity. Antibiotics, especially when you have frequent courses at a very young age. So when I get new patients in the office and the parents are like, oh, well, Johnny is 2.5 years old. We've already been on antibiotics almost 20 or 25 times. We just can't break the cycle. I think we're probably much more likely to find an old boot or a kitchen sink in their GI tract than a good bout of healthy bacteria. So that would be something that would trigger me to do a more intensive workup on their GI tract. Acid suppression medications, it never ceases to amaze me on how many of these kids at a very early age were placed on proton pump inhibitor medications or H2 blockers that stop you from making stomach acid. And stomach acid has two really key roles. It helps you to digest dietary proteins, but probably more importantly for the microbiome is it sterilizes things that you eat. So if you are not sterilizing your food properly, you and I, Kristen, we eat things every day that are cross-contaminated with pathogenic flora and parasites and yeast and mold and fungus, and we take for granted that a good, healthy GI tract with a good production of stomach acid can just handle that, and not very much of the abnormal bacteria or microorganism makes it to the small intestine. Once the stomach acid gets compromised, whether it be from a medication or a genetic issue or a mitochondria issue where you can't make enough stomach acid naturally, a condition called hypochlorhydria, it leaves you really vulnerable to atypical bacteria populations, especially in that small intestine. Other things that can lead to abnormalities of the microbiota, pancreatic insufficiency, leaving too much undigested food product too far down in the GI tract. Where there's food, there's something that can live and survive off of it. Excuse me. Poor motility. affects whether or not your microbiota is healthy. Thyroid problems, blood sugar control, immune deficiencies and dysfunction, which is relative. I actually saw a new research paper that came out the other day that linked sucralose with damage to the microbiota. And last but not least, we see microbiota changes with kids who are exposed to large amounts of chlorine, kids who are on swim teams, take swim lessons, or fluoride exposure. We have a lot of kids who do poorly with their microbiome after ingesting a little too much fluoride.
Well, I know when my son was first born, granted he was born in 2002, and I don't know what they're doing today, but I was told to give him water with fluoride in it, before I knew any different, and that was very common. I'm assuming they probably might recommend that still in the general population, but once we learned, all the different toxins that were going on in his body, it was the first thing that I took away because I felt like why add more toxins to his system unnecessarily. Go ahead, I'm sorry.
Completely understandable, and that's a talk for a different day, but adding fluoride to your water system or to your toothpaste to help with tooth health is not as supported in the literature as one might think.
Now, you've heard of babies being recommended to drink the water with the fluoride in it, right? I don't know, do they still do that today?
That is something that still occurs, yes.
Wow. It seems so crazy to me, especially everything. I guess when you're living it and you're in it day in, day out for the last 10 plus years, it's like, you think that we would have learned by now, but I guess we still have a long, long ways to go, which is why this summit is so important for especially a lot of the new families out there listening. And so you did mention a little bit about, bowels. How often should a child, a lot of times people will think their children are having, traditional bowel movements. And then when you ask them, you say, well, how often do they have a bowel movement? And they might say, oh, every other day or every third day. Is that something that is okay? Is that something that's normal or healthy? What's your take on that?
Yeah, I think a perfectly healthy human being should have 1 to 2 bowel movements per day. I see a lot of patients come through my office who their local doctor or their gastroenterologist says that it's normal that their child is having a bowel movement every 3 to 5 days. And getting rid of solid waste is just that. We're getting rid of toxins that the human body doesn't need or want. If we leave them in the GI tract for too long, they start to cause a little bit of damage. Some of these bacteria actually can make an enzyme called beta-glucuronidase, which breaks down the bond between bile and toxins that the liver already worked really hard to detoxify. Once that bond is broken, the toxin can then be reabsorbed through the GI tract and have to pass through the liver a second time for detoxification, stressing an already overworked detoxification system in our kids.
Now, our kids, it's not the first time I've heard that about the liver. It makes me think, how are our kids' livers if they're, double trying to detoxify stuff? It seems as though, that can't be a good thing either.
Yeah, in general, we don't find a lot of stress on their livers, but still, it is an unnecessary burden. Sometimes I think with our kids who have severe overgrowth of bacteria, I almost think we should treat them like a patient with hepatic encephalopathy. That's a condition where when your liver starts to fail you, you can't clear the toxins that are normally coming through the GI tract from your flora, and it causes you to have an encephalopathic condition and really presents a lot like our kids. Even though our kids don't have the liver damage, I still think that they're getting a lot of neurologic involvement from the toxins being absorbed through the GI tract.
And just what unnecessary, energy being taken from their system that they don't need to be constantly trying to detoxify, right?
Absolutely. I mean, you could probably ask almost any family at random at any of the larger conferences that you or I attend and ask what happens to their kids when they give them a little bit of activated charcoal or a binding agent like that. They say, well, you know what? They actually look really pretty good because those are toxins that are now not being able to be absorbed into the body and they're being removed from the system with solid waste.
It's crazy. I feel like there's just so much, and I'm so happy that we're here talking. And, when you're looking at the abnormalities in microbiota associated with increased gut, permeability, how come? Why are we looking at this? Why is this happening? I know we talked a little bit about it, but it seems like it's increasing.
Well, I think if your average parent understood the battle that goes on even in a healthy GI tract every single day, the demarcation line between health and chaos is only 1 cell layer thick in that small intestine. So You could be the healthiest person in the world or the sickest person in the world, and it could all just have to do with how well that one cell layer thick is. So we talk about increased gut permeability or leaky gut. This is when the space between the cells, the human cells that line the GI tract, is too great, and it allows toxins to actually get around the cell and not have to be absorbed through the middle of the cell. There's two ways that an abnormality of your microbiota kind of take advantage or exacerbate this. One is some pathogenic flora just directly affect the gut permeability by altering the a protein in the GI tract called oculin. Oculin is a protein that sits between two cells. The space in between there, we call it the gap junction. So think of this as kind of like parking spaces, and that little white line between your parking spaces is where the oculin would sit. So if you have certain pathogenic bacteria like pathogenic E. coli or C. diff or even rotavirus, it doesn't allow that oculin to get in that space. So there's a little bit of a gap between these cells, and now toxins start to leak through. The other way that an abnormality of your microbiota can affect the gut permeability is if you have a little bit of permeability issue for some other reason. Perhaps it's a food allergy, maybe it's because you needed to take some ibuprofen, who knows. But if some of these toxins leak through, they then trigger things downstream that indirectly affect the permeability. Like, for example, let's say you had a candida overgrowth, and the toxins from the candida were leaking through and were causing you to have a flare of eczema. And we know that kids with atopic diseases like eczema tend to have leakier guts. So here your yeast toxin leaks through, creates you to have eczema. The eczema worsens the leaky gut status, and now even more toxins leak through. So it's kind of a vicious circle.
Now, at what point in your biomedical treatment do you even recommend evaluating for microbiota?
Well, I got to tell you, it's part of my initial evaluation for every kid. I think that everyone should have at least a basic screening when they come to see somebody like myself. And then, depending on what we find with the history or the physical exam, or if they've had some testing done by previous providers, then we can expand on that. But I think having a good working knowledge of what's going on in your gut is super important to you if you want to help treat your kid with a biomedical approach. I actually believe that there are three foundational processes that parents and providers need to know about each of the kids that are either in their family or in their practice to have the best possible outcome from a biomedical approach. As you know, there are hundreds of things out there. We learn about new things all the time. But I feel if you don't have these three things, a good working knowledge and good control of these three things, it really doesn't matter what else you put, because now you've built a house on sand and your whole biomedical platform will be a bit unstable. Those three foundational things are methylation, your mitochondria, and your microbiota. And unfortunately, it's not clearly demarcated. There's a lot of overlap. So methylation can affect your microbiota can affect your mitochondria. So there are three areas, but there's a lot of overlap between those areas.
Now, we talked a little bit about the testing. I'm sitting here, I'm learning so much. I'm actually taking notes as we're talking. and I've been to many conferences and I've heard lots of different talks, but I feel like even if we're parents out there that are listening that are veterans, we still learn, so much every day. You talked a little bit about some of the tests that you send out. Are those pretty much the standard tests you utilize in evaluating microbiota?
Yeah, I'd say as just a pure basic screening for your average run-of-the-mill child with autism who comes to see me, I'm going to recommend that you get like a microbiology stool test, which is a little miniature version. It gives us the flora piece only, it gives us yeast and bacteria, and sometimes we'll do an organic acid test. Again, there's a few labs that offer tests like that. Probably the most famous would be Great Plains Lab there. They're not invasive. They're relatively easy to obtain. They're not break the bank costs. And then for the more involved cases, whether that's a new patient with a strong suspicion of abnormal microbiota or an existing patient with atypical initial screening or a new onset regressive behavior, I'd recommend a more complex stool test, like we call these comprehensive stool analysis. In addition to the microbiota, they often give us an immunology piece, a digestion and absorption piece. And then even for some of the kids, if it's possible, and this is difficult in the littler kids, but if possible, we would even get what's called a small intestinal bacterial overgrowth test, where you take a small amount of a non-absorbable sugar called lactulose, and then we get breath samples that are timed intervals afterwards. If there's a overgrowth of a bacteria in the small intestine, once the lactulose reaches it, it will get fermented, and we'll see an increase of either hydrogen or methane. And so a breath test can tell you, in general, is there small intestinal bacterial overgrowth? Yes or no, check a box. But then depending on which test tube actually comes up positive, you can tell how far into the small intestine that infection is. The most common area to get SIBO, or small intestinal bacterial overgrowth, would be in the terminal ileum. That's where the large intestine and small intestine meet. Normally that valve is a one-way valve, the ileocecal valve, so things leave the small intestine, reach the large intestine, and nothing goes backwards through that. Unfortunately, if you have motility problems or you have inflammation, maybe that valve doesn't close the way it's supposed to, and bacteria is allowed to grow back through it. For people who have hypochlorhydria, whether that's genetic or mitochondria-induced or medication-induced, we'll start to see the small intestinal bacterial overgrowth tests pop up very high. So they're having problems in their duodenum. So one of the first tubes will start coming up positive. So we can learn a lot with those tests. And then there are a couple other tests that we can get blood test-wise. Sometimes I'll look at an amino acid profile. We're looking for deficiencies. We're looking for other nutrient deficiencies like iron or zinc deficiencies. And then occasionally we'll do a much more complicated test, an advanced test called a stimulated cytokine profile. It actually looks at your body's immune response to various toxins that are coming from GI sources, like lipopolysaccharide actually is tested. So they take a sample of your blood, they put a known quantity of lipopolysaccharide against that sample, and then they watch to see what the immune system does. And sometimes it looks pretty crazy.
Wow, it seems like there's definitely a lot of tests out there to really be able to be a good detective to see what's really going on in our kids' bodies.
For sure, and it's getting a little better every year. We get even better tools than the year before to help identify and treat these problems.
How often do you recommend doing the testing?
So it really depends. So if you come to see me and your initial testing is clear, we may maybe do a cursory check once a year, or if a new onset symptom dictates. So if your child has been sleeping well and all of a sudden, out of the blue with no known trigger, little Johnny is waking up every night at 3 o'clock in the morning and staying up for an hour, or we're having food refusal or bloated belly or something like that, or especially if these things are coming up after a course of an antibiotic like you had to take for an ear infection or sinus infection, at that point in time we would want to. For kids who have known dysbiosis, then what I try to do with my parents, because our goal is not to necessarily drain all of your resources with repeat testing. But in the beginning, we would want to test every time we had a little bit of a setback or a flare, and then we would start to get a little bit of an understanding of what type of presentation equals what type of results on the stool test or organic acid test at that point in time. Once we're 3 or 4 tests deep and we have a good understanding of what's going on, at that time, oftentimes we'll treat based off of the symptoms and not necessarily require the test.
Insurance, I know for my son at least, insurance does cover some of these tests that you're talking about though, right?
Yeah, it's hit or miss. I wouldn't say that they all cover, and it depends on your plan and whether or not you are an HMO or a PPO, and if you have in-network benefits or odd-network benefits. But I'd say that a fair amount of people get these types of tests covered.
I'm just wanting the families to listen that are listening for the first time, so they understand there's some, like not all tests, but some tests definitely can be covered. And then, how do you initiate treatment once the abnormalities are identified?
Well, once we identify that you have a problem with your microbiota, and let's just assume that's a dysbiosis, where we have a pathogenic bacteria that's grown out of control. All these pathogenic bacteria are what we call opportunistic bacteria. They don't tend to grow in people whose GI tracts are healthy. Their immune systems are able to modulate them, and the regular flora can modulate them. But in the right circumstances, it kind of takes off like a wildfire on a windy day, and it can grow out of control really quickly. So the first step is to try to reduce and manage any of the pathologic overgrowths, whether that be yeast or bacteria or even a parasite, like if you had pinworms or Blastocyst hominis or Dientamoeba fragilis, something like that. So this sometimes requires prescription antibiotics and antifungals. Sometimes we can manage with natural agents. It really just depends on what type of pathology we find. Then we start to look at all the underlying and predisposing factors and correct as many of them as we possibly can. We would consider adding in additional digestive support in the form of enzymes, We would add in some additional anti-inflammatory support to take some inflammation away from the GI tract. When your GI tract is inflamed, it's a little bit more permeable. The more inflamed your GI tract is, the more it would promote abnormal flora. We could consider adding in some stomach acid support. We want to support the motility to make sure that bowel movements are happening frequently. We could add in an immunologic support like Enteric, which is an oral immunoglobulin. And we could even consider something like hyperbarics to manage Clostridia and inflammation.
And so, once the acute abnormalities are addressed, will this require additional treatment? Or is it like a one and done kind of thing?
Well, I think sometimes maybe it's the fault of us as providers that we're not explaining it well enough. Very rarely is it a one and done. So unfortunately, these pathogens tend to reoccur. When the microbiota is damaged very early in life, it greatly affects the species diversity. The more diverse your microbiota is, the more stable your immune system and your body seems to become. It's kind of like diversifying your investments so you reduce your risks with your money. Same thing in your GI tract. So the more species of flora, the more balanced you are. It is possible over periods of time to create a more normal microbiota, maybe never quite to the point of absolute normalcy, but a more normal microbiota, but it definitely doesn't occur overnight. And the parents sometimes become a little frustrated and a bit discouraged when their kids respond so well to microbiome management only to have their symptoms start to return shortly after the treatment ends. To me, that's an opportunity to change around a baseline status. Perhaps, we weren't ready to end the treatment. Perhaps we need to make an adjustment to the treatment. I like to think of improving your microbiome not as a treatment, but more of a process. And there's a number of steps in the process. So if you treat for, say, Clostridia once with vancomycin, and your kid looks like a rock star or is a cape short of being a superhero, and you stop that vancomycin, and then a week or two later your symptoms come back, that doesn't mean the vancomycin failed you. It means that we're controlling a level of symptomatology in the form of Clostridia, and we still have to fix the underlying problem so the Clostridia won't find it as an opportunity to grow and come out of their spores.
When you're talking, and I'm sure people are listening, that might never have heard of a lot of these things we're talking about. I don't think this is a standard thing unless you're in the autism community, right? Like this isn't typically stuff you talk about at dinner, right? They're probably thinking to themselves, it sounds as though there's just some almost like these just crazy I hate to say the word monsters, but it almost sounds like this bad bacteria and this bad stuff, and it's like this whole war going in within our children's guts. And it sounds as though one thing might be happening over here and then another thing might be happening over there. And so it's so important for us to find people like you and others that are really, specialized in this to know what they're looking for and know what to test.
Absolutely. There's 10 times more non-human cells in your GI tract from this microbiome than there are human cells that make up the rest of your body. And sometimes I wonder who's in charge of who.
Well, and why aren't normal doctors, and I hate to use the word normal, but let's just say traditional doctors, why aren't they doing more testing? I mean, I feel like one of the number one things I hear from families that especially are new to this, they'll say, I went to my, general doctor and, some of the things I first learned about, they said, no, there's no need to test for that, or no, that's not necessary. But yet, for people that have been in the community for a long time, we know how important that is. Why is the general pediatricians and the general doctors out there, why aren't they learning more about this?
Well, there's definitely literature on it, and there's some mainstream literature that comes out on it as well. It would require a gigantic paradigm shift with just traditional medicine. So they want to treat an illness and be done with it rather than manage it as a long-term problem. It also doesn't help that your common labs that are covered by your insurance, like your LabCorps and your Quest and your bioreferences, don't have this type of testing available. So it makes it a little difficult for the traditional primary care doctor.
But I want the people listening to know that even though they're saying that doesn't maybe make sense to them, that's why it's so important to find somebody like you and others that are really specialized in this field. Would you agree?
Yeah, absolutely. I mean, if you asked your cardiologist, about a mole on your back, he's not going to really know what you're talking about, and that doesn't make him a bad a bad cardiologist. It's just not in his wheelhouse or what he talks about every single day. Traditional medicine has become very subspecialized, and unfortunately, this type of thing just does not match up with any of the current specialties.
Now, in addition to autism, are there any other conditions associated with the abnormalities in microbiota?
Yeah, actually, microbiota abnormalities are associated with a number of conditions. In particular, there's a strong role for several autoimmune diseases like type 1 diabetes, rheumatoid arthritis, muscular dystrophy, multiple sclerosis, and even fibromyalgia. There's also a link with allergic and atopic diseases like asthma, allergies, and eczema. And some of the more recent research is linking problems with the microbiota to neuropsychiatric conditions like depression and bipolar disorder.
And so we kind of talked a little bit about this, but these issues are not being identified or uncovered by just our regular doctors that are specialized in gastro or just traditional doctors. When you go, we just talked about why perhaps, but it just seems that it ends up hurting some of our kids because a lot of people don't know that there's people out there, like you guys, really helping this kind of fight and this battle for our kiddos. How do we make it so these doctors can hear more about it? I mean, I know you said it's published and it's, in traditional medical journals. How do we really promote that to these doctors so that way some of these parents that, this is the first time they're hearing about it, they can at least bring that to these doctors and say, hey, look what I'm reading, can you help me with this?
Absolutely. I mean, I think a lot of our parents, when they are first given the diagnosis, are not really given any options or advice of things they can do. Most of us, when we got the diagnosis for our kids, are told to see the developmental pediatrician, maybe do some ABA, some speech therapy, occupational therapy, and eventually we'll find the right medication blend for them and have them live at home as long as they can, and they'll help you find a place for them to live. But there's so much more. As you know, when we go to these conferences, we talk to all these great families, and they can't believe the plethora of data and things they can do. Autism is not a static condition. There are things that we can do to modify it. I wouldn't say that I have a treatment specific for autism. I think that would be a bit of a misnomer. But there are a number of biomarkers that are reliable. There are a number of biomarkers that we have great ways of testing. And I find that if you can identify these biomarkers and treat as many of them as you can, then the kids will get better. Are we treating autism? No. I mean, sometimes we're treating a slightly abnormal thyroid or some constipation. But as we fix these underlying conditions, it seems like the overall autism starts to lessen. So parents are always super excited on our first follow-up when they see that there are things that they can do that are within their control, that are relatively easy and relatively inexpensive, and it can change around their day-to-day life for them and their kids. So just getting a child to sleep through the night or to poop on the toilet or to not scream or stem all day long is huge. That's worth its weight in gold.
And we always talk about this. There's no small victories, and when you combine them not sleeping and having constipation or diarrhea or aggression behaviors or lots of stems or the list goes on and on. If you help one of those symptoms, that's a huge victory, and then you help another symptom, and that's another victory. And I know when I always think about things like this, I think, gosh, how can we have our kids in all these therapies? And it's so great. I mean, I'm definitely, for therapies. However, if our kids aren't feeling good on the inside, it's very hard for them to focus on the outside. Would you agree?
Yes, I do. I actually think that the kids who do the best find that balancing point between their therapeutics and their biomedical. A lot of our kids are actually really pretty sick kids, and in the beginning they maybe need to be a little biomedical heavy, but as we repair things, then you'd want to be able to be sure that they're getting the appropriate therapeutics and educational interventions that they need. I don't have a pill or a treatment that gives you conjugated verbs or pronouns. All I can do is make your brain a little less stimulated and maybe make you a little bit better ability to pay attention and free up some of that stuff so that you can get into a right learning environment. So, yeah, I don't like it when parents put all their eggs in the biomedical basket or all their eggs in the ABA basket or the therapeutic basket. I think it takes a blend of the two. You can't ABA away a yeast overgrowth, and I don't have a prescription that teaches you to match colors.
And I think that for so many of our kids out there, I mean, it seems as though they're in the schools. A lot of times they don't ever talk about biomedical. And I know for me, I'm always good at telling you all my mistakes, right? And I really put all my eggs in one basket originally for just therapy, and then I learned more about biomedical, and it is this balancing act, and sometimes, you kind of feel like you're getting it right, you're like, yay, and then something kind of, maybe your child gets sick, and then it kind of disrupts everything, and you kind of have to kind of figure it out again a little bit, but it all, that's why it's important to have good doctors that you're working with, because it all kind of balances out. And we didn't address this really, but we definitely have a little bit of time left. How does diet affect this? I mean, when you're looking at the bowels, like anytime I'm thinking about bowels or I'm thinking about, bacteria or Clostridia or any of these things, yeast, I think that diet plays a role in this. What's your belief on that? What's your thought on that?
Yeah, for sure. So diets that are high in heavily processed foods are going to become problematic for the microbiome. So that if we eat too much sugar, that candida is going to be a problem. We also have some of those gram-negative bacteria that will really grow very well in an environment where there's lots of fermentable material. Like Klebsiella, for example, is a really notorious bacteria for our kids. And the outward symptoms look a lot like a yeast overgrowth, but it doesn't respond to a traditional antifungal medications. But these kids are craving carbohydrates, and they'll eat every processed thing. They'll avoid every healthy thing that you cook them in favor of sitting down and eating a bag of sugar if you let them. So we want to make sure that we eat things that are not too inflammatory for our system. We want to eat things in balance. We don't want to eat too much processed food. As mentioned earlier, sucralose is the first, and I don't think it's going to be the only one, of the artificial sweeteners that is now linked with damage to the microbiome. So yeah, the healthier your diet is, the better you're going to be. I've heard this saying a number of times before. I can't even remember who was the first person that I heard say it. There's no such thing as junk food. There's either food or there's junk.
I like that.
Want to make sure that you're making healthy choices for your kids, because they're kids and they're not going to make these choices for themselves. And I understand that our kids are self-restrictive and we're trying to follow gluten-free and casein-free, and we already feel like we're depriving them. But we still want to make the best choices we can, even within those restrictions that are possible. Get as much nutrients as we can. Keep that GI tract as healthy as possible. Again, the difference between a healthy life and a chaotic life is only one cell layer thick, yet take good care of that layer of cells.
Absolutely. And, we talked a little bit about the victories. I want to kind of go back to that. We hear often people get, nervous of the word recovery, and recovery means something different to a lot of people, right? Like how I think of recovery is meaning no traces of their former diagnosis. But a lot of other people might think of recovery as they're sleeping better through the night, or they're talking for the first time, and maybe their gut's doing better. But I think that a lot of things you were talking about is helping that child feel better, as we were talking about earlier, from the inside out. And for me, that helps them create a relationship with you, and that's where you get the first words and the I love yous, and the being able to, as you were saying, match colors, but getting to do that together for the first time, right? I think that a lot of the people listening right now, all these steps you're talking about and making sure that the gut is healthy is what's going to help us really form a true bond and a relationship with our child. What are your thoughts on that?
Yes. So you wouldn't really want to deal with me on a day at work where I wasn't feeling well, where I was having some GI issues, and you're probably the same way. So imagine that with our kids who are already starting from a disadvantage, where they don't have the communication ability, they don't have the right pain sensations in their GI tract, and they don't really know how to make heads or tails of this. And honestly, some of our kids have had GI anomalies so early in life that they just come to accept it, that they think that becomes normal. And as you start to make them feel better, I think it opens up a whole world of opportunity for us as parents to kind of get into autism and maybe grab a hold and get some better interaction and language and participation with our kids. It's really pretty cool.
Absolutely. I know with my own son, for me, he's not recovered, but he's doing so much better. And but the thing I'm most excited about is, just like you were saying before, a lot of times the traditional doctors will say, they're never going to do this or they're never going to do that, and you're going to have to think about, where you're going to put them later on in life. And those are very similar things I was told, and probably a lot of the people listening were told. And I am so excited because all the things they said he could never do, he's already done and proven them wrong on that. And, he definitely is not recovered, but he is definitely, I always tell him, dude, you're my best friend. He is my buddy. And we definitely have a great relationship. And I think for parents listening, I know sometimes it can be scary. I mean, especially listening to all these words that we're not used to talking about at the dinner table, or we're not used to talking about when we go to coffee, or, hang out at a dinner. This is something very new to a lot of people. And by all the things you were talking about and all the different methods you were talking and the testing that you were talking about, that's all going to lead to being able to have a better relationship with our child, so we can, maybe have just a dinner with our child. That was a big deal for me, to be able to sit down at the dinner table and have a meal with my son, or to be able to take him to the park, or to be able to take him to the beach or to an amusement park. And those are huge. And so there is no small victories on anything we're doing, but all the steps, to get to that point is a lot of the stuff that you're talking about, a lot of this testing, and a lot of the things that the parents might be scared to do. And honestly, I mean, to be able to have your child get a stool sample, it might not be fun, but it's not that scary. Would you agree?
Really not too difficult. Not fun, that's for sure. But yields you can get out of a single stool test can be phenomenal and really make huge changes in your child. So we would do anything for our kids. And I think this is relatively easy to do. We're not talking about spinal taps or muscle biopsies. I mean, we're talking about collecting a little bit of poop or maybe some pee samples and seeing what we have.
Absolutely. Now, how do people find out more about you? I know a lot of people are listening going, how do I get in contact with him?
So I work at a place called Central Florida Functional Medicine. We are currently in Melbourne, Florida. We're getting ready to relocate to Merritt Island, Florida, so we'll be right by NASA and the Cape Canaveral cruise port here in Florida, about a half hour east of Orlando. The easiest way to get in contact with us would be through our website, which is just centralfloridafunctionalmedicine.com.
Wonderful.
You learn a little bit more about us there, and there's a couple of areas where you can request some additional information or new patient packets.
And that's they can do all that online, is that right?
Yeah, that's right.
Can you say that website again for them?
It's centralfloridafunctionalmedicine.com. I like those titles to be really super long and complex.
Wonderful. And that way they can figure out how to get that packet and to make an appointment. And then, they'll already be one step ahead of the game because they now just listened to this and learned a lot about some of the stuff that you'll probably be talking with them about and wanting to test with them.
Yeah, I think that they would not look like deer in your headlights when we start talking about the gut. I think that this would be a good starting point for them.
Absolutely. Well, I am so grateful that you took this time with us, Scott, and I think we've helped so many families to just get a better understanding and letting them know it's not scary. Their words they're not used to hearing all the time, but it's definitely not a scary thing. It's something that definitely it sounds definitely treatable, and there's definitely a plan there with all the different testing and different protocols.
Absolutely. And I just want to say, Kristen, that I really appreciate all the hard work that you do through Autism Hope Alliance. And it's been great working with you guys. And hopefully we'll have a continued relationship in the future.
Oh, wonderful. Definitely, Scott. Definitely. Thank you so much.
Yes, ma'am.